I did my project over the study of the Hantavirus. The Hantavirus was discovered between 1950 and 1953 when, when Korean soldiers and American soldiers were fighting in the Korean War. Many soldiers came to nurses and they developed breathing ailments and stomach problems. And nurses during this time called it war nephritis. 20 years later, though, researchers Carl M. Johnson and Ho Wang Lee discovered that this nephritis was a virus, and they named it the Hantavirus. It was named exclusively for the Hantan River region in South Korea, where many of the rodents who were infected with the Hantavirus gave the virus to the soldiers. And humans can contract this by being in contact with infected rodents. The researchers, one was Ho Wang Lee, and he was a South Korean virologist. He graduated from Seoul National University College of Medicine. And another one, his colleague, his name was Carl M. Johnson, and he's now an American special pathogens researcher for the Center of Disease Control. And he graduated from the University of Rochester Medical School. And he has also worked recently with the Ebola virus research. The carriers of the hantavirus are any animals within the rodent family. So that's shrews, rats, mice, moles, and hares. And these are just a picture of some. This is a shrew. That's a mole, a rat, and a hare. The microbe structure is described by a single spherical and their enveloped cells. There are 3 segments of negative stranded RNA labeled the S, M, and L, meaning small, medium, and large. Its surface structure is square and resembles a grid. It's gram-negative, so it means that it has a thinner peptidoglycan layer than gram-positive bacterium, and the cell is 80 to 100 nanometers in diameter. The cell invades and causes infection. Humans can only contract this by inhalation of aerosol, rodent urine, droppings, or saliva, and it can leave humans susceptible to the virus. And the virus infects hosts and replicates directly through the host cells through the S, M, and L segments of the RNA. The cell then translates the mRNA of the hantavirus in the endoplasmic reticulum of the cell it's invading. And the final stage is exocytosis, where the cell releases its secretory vesicles and it kind of explodes out of the plasma membrane. Its attack points in the body are the cells of the esophagus, intestinal tract, kidneys, and the lungs. So symptoms associated with the hantavirus are very similar to those of the influenza virus. It can cause fever, chills, headaches, nausea, vomiting, and stomach pains. And many diseases that are that come from the hantavirus go through a process called pathogenesis, and there's 5 phases to the process. The first is the febrile phase, and it begins immediately after the potential subjection of the virus, and its symptoms are the basic ones, which include coughing, dizziness, headaches, fever, and chills. The second is the hypotensive phase, which occurs on the 5th day. The third is the oliguric phase, which is the 9th day, and the symptoms include plasma loss, acute renal failure, which is failure of the kidneys, and death actually occurs 25 to 35% of the time in this phase. And next is the diuretic phase, which occurs 12 to 14 days after transmission, and the convalescent phase, which takes 4 months to reach. And many patients in this stage actually experience death because it's so far within the disease. The disease is stemming from the hantavirus. Obviously, if the person is affected by the virus, they're susceptible to the diseases that can follow from it. The first is the hantavirus pulmonary syndrome, or the hantavirus cardiopulmonary syndrome, which people call it, and they have labeled it HPS and HCPS. and the hantavirus hemorrhagic fever with renal failure, which is labeled HFRS. The hantavirus pulmonary syndrome is nicknamed the Four Corners disease because at one time there were outbreaks in the four corners of the U.S. So there was one in the upper west, lower west, and the upper east and lower east parts of the United States. And the symptoms include lethargy, shortness of breath, and this disease is often fatal because it infects the lungs. And then the next is hantavirus hemorrhagic fever with renal failure. The symptoms take 8 weeks to develop, and they include those similar to flu, with headaches, nausea, and vomiting, and it can lead to tachycardia, which is a heavy beating of the heart, and it occurs through pathogenesis, which is the 5 steps of the disease, and it can onset renal or kidney failure. There aren't many vaccinations or cures for the virus, but there are some being tested at the time. There aren't any that are acceptable for use in the U.S., but they are heavily used in Korea and China, in South Korea and China. There's one type of vaccine called the inactivated virus vaccine, which is used primarily in China, and it takes 2 to 3 vaccinations in 2 to 3 week intervals. And then one is the molecular vaccine, and the molecular vaccine hits the virus at like a molecular level, so it really targets the S, M, and the L segments of the RNA in the cells of the virus. And then next is another vaccination is through a gene gun, and it shoots like healthy cells through gold particles into skin callus cells. The other widely known remedy for hantavirus is the patient is taken into ICU and is given oxygen therapy to aid in breathing and process of the lungs, because the lungs are most affected. And that is